127 from Fawzia sheet. Okay. I share the screen. I think you can see the screen now.
Yes, Prof.
Okay.
Can see the screen.
All right. Okay. So this is the first question. We start from 1 to 8. A 45 years old man has established post-hepatic cirrhosis. Follow-up appointment, a palpable spleen, four-fingered burst below the costal margin. Full blood count show persistent thrombocytopenia. This is what we call this thrombocytopenic purpura. So bone marrow examination has been megalocortic hyperplasia. What is most likely cause of thrombocytopenia? Thrombocytopenia occur usually in big spleen, can be secondary hypersplenism in big spleen, whatever the cause, and also can be primary in a small spleen in some patient of the ITP or idiopathic thrombocytopenic purpura. Actually, what happens, the platelet is sequestrated in spleen, not distracted. It becomes sequestrated, and the patient have low level of platelets. It is important to know the half-life of the platelets is about 4 days in the human, so it is very short period. So any effect in the bone marrow, any effect in any organ is reflected directly to the spleen. Second question, and it's very common. 5-year-old boy presented with recurrent attack of pneumonia. Culture show Pseudomonas aeruginosa. His mother confirms that have meconium ileus in the neonate period. What the following is most likely finding in the body? So anyone know what is this disease? What this patient have?
Cystic fibrosis.
Cystic fibrosis or mucovasculosis. So in this, what is the material is increased in the sweat of the patient?
Increased sweat chloride.
Yeah, so increased sweat chloride. So in the sweating, they have increased chloride. This is common question because cystic fibrosis is common in European country, and nowadays it is one of the main indication of the heart lung transplantation or lung transplantation. Lung transplantation don't done in many country, but if done, usually due to cystic fibrosis. This is question. Next question is tricky because we see this question before, but just notice the difference. It is a 42 years old woman has a cholecystectomy, developed self-limited post-operative wound infection by Klebsiella. Klebsiella is called Klebsiella pneumoniae. It is encapsulated bacteria. I just add this, but in the real question is just Klebsiella. By what process would the bacterial ingestion has been enhanced? I think one of you answered this question before. What is your answer here?
Opsonization, because this is encapsulated bacteria.
All right. So if it is encapsulated bacteria, so the answer is opsonization. If I remove Klebsiella and write just wound infection or staph or normal organism, not encapsulated organism, so the answer is just phagocytosis. Phagocytosis opsonization is the same mechanism that you kill the bacteria, but the difference in phagocytosis, it is direct to kill the bacteria by macrophage, but opsonization is killed the bacteria after coating by opsin secreted from spleen. In some books they called it, this is opsin is like a ketchup you put in the food so become tasty. So they say this opsin is become to identify and be tested by the macrophage. So again, this is question is very common, and even in the YouTube channels, other YouTube, you can find the difference. So no difference. If it is encapsulated, so opsonization. If it is not encapsulated, so phagocytosis. Next question. After resection of the rectum tumor, patient experience erectile dysfunction, and also this common question. Of course, after resection of the our abdominoperineal resection or rectopexy for rectal prolapse, the patient signs the consent of erectile dysfunction. Here they ask about, of course, erectile function or erection is parasympathetic. So anything sympathetic is not included. So what is the nerve responsible for erectile or for erection? Anyone?
Pelvic splanchnic nerves.
Say again?
Pelvic splanchnic nerves.
Yeah, pelvic splanching nerve. Yes, it is parasympathetic. So you can find in the question many name like parasympathetic is correct, pelvic splanching nerve is correct, preganglionic, not postganglionic, preganglionic parasympathetic is correct, nerve argenti is correct. All these are parasympathetic, which is responsible for erection. Next question is about a 15 years old girl has been treated by 40B over previous 6 months. She present to her doctor with fatigue, loss of appetite, weight loss. On examination, blood pressure is low and the increased pigmentation. This is important, especially in Southeast Asia, because we don't have much patient of the TB, except maybe in India. But I see in my life in Malaysia a case, and the patient just complain of syncopal attack and change in color. Okay, forget the TB. If the patient have syncopal attack and have increased pigmentation in the body, what it could be? I remember this patient, after we examined, we found she is also have pericarditis. So the patient can have hypotension, pericarditis, increased pigmentation. So what's your diagnosis?
Addisonian crisis.
So it is Addisonian crisis. It is common to diagnose in the European country because they are white color. So just little change in pigmentation is noticed by the family. Syncopal attack. So I remember many of these patients, they have syncopal attack. They go to clinic. He give him corticosteroid. Blood pressure is become normal. He don't know why the patient is improved. But after many investigations, they found this patient have Addisonian crisis. They found Addisonian crisis, one of the causes. Addisonian crisis is till now is not clear. They say it is idiopathic. But one of the causes of Addisonian crisis can be idiopathic, can be due to tuberculosis. Okay, so this is important. And this patient, what we tested is ECT stimulation test just to diagnose Addisonian crisis or high level of cortisol. Okay. A 70 years old man with a history of alter bowel habit. Alter bowel habit, of course, it is like constipation and diarrhea, and it is common in the diverticulitis, common in cancer colon, with dysuria, nematuria, and E. coli, Escherichia coli in urinary tract infection. Nematuria means that air come in urine, and air come in urine, it means that they have a fistula with the colon. Can be diverticulitis, can be cancer colon, so they have a fistula between colon and urinary bladder. CT scan show mass involved sigmoid colon and the bladder. What is the commonest cause of this? So can be both, can be adenocarcinoma of sigmoid, can be colonic diverticulitis, but CT show mass involved in the sigmoid and the bladder. Dysuria, okay, what is the common cause of this presentation? Actually, both can be correct, but the correct answer is colonic diverticulitis. I think we can add fever or something in this scenario. So make it because diverticulitis have a fever and the cancer don't have a fever. Cancer also have loss of weight, loss of appetite, not mentioned here. So this is usually colonic diverticulitis. Of course, Crohn's is difficult to do that. Transition cell carcinoma is not cause this. So the answer is colonic diverticulitis. If we added loss of weight, loss of appetite, or CEA, carcinogenic embryonic antigen is high, so can be adenocarcinoma of the sigmoid colon. Next question is a 30 years old man assaulted in the hammer and sustained breast fracture at the vertex. Vertex means the front of his skull. Profound venous bleeding and the notice fracture site. What is the vascular structure is most likely have been perforated? Of course, this is anatomic question, and he asked about what is the front area of the skull. So what is your answer? Just this area. So what is usually your answer?
Superior sagittal sinus.
Superior sagittal sinus. Okay. Next question is a 57 old heart transplant recipient is keen to join cardiac rehabilitation program? This is also common question, as we mentioned before. In the heart transplantation, the heart is not connected to either sympathetic or parasympathetic, and the increased heart rate within limit depend on the venous return, depend on circulating catecholamine, depend on the atrioneurogenic hormone, and all this. Okay, so the answer here is increase atrial filling. It is like mechanical pump, so the venous return affected this, so it is look like mechanical pump. It's very common question, by the way. 28-old woman fell 9 meters while rock climbing. She had a renal transplant for polycystic kidney 2 years ago. She is brought to emergency department resuscitation. What is appropriate analgesic giving? He just need to ask you what is the safe analgesic to the kidney, because you know that we have something called analgesic nephropathy. Analgesic nephropathy, and this patient is in critical situation. So what is the analgesic drug would be the safe? In the other version, we have the same question, and they ask what is the most likely adverse effect. He has renal function in this patient. So the most worse is diflucanic acid. But of course, not are safe, but what is the most safe? What is your opinion?
Paracetamol.
Yes, the safest or less side effect or be safer is paracetamol. But other diflucanic acid and all these are very dangerous. Okay, take care, because this question, if come, what is the which one of the following analgesic would be the most likely adverse reaction or more dangerous? So the answer is diflucanic acid. Of course, still they have side effect, but it's the safest analgesia. Next question, 77 years old man admit acute urinary retention secondary to benign prostatic hyperplasia. Urinary catheter is inserted with free fluid, concentrated urine. Which of the following best account action of countercurrent multipolar system that lead to concentration of urine in loop of Henle? Of course, this is physiology question, and he just need to ask you what happened or what is the cause of the concentration or loop of Henle. Of course, you know, loop of Henle have ascending part and descending part, thick part and thin part, but he need to what is the action of countercurrent lead to concentration. He need to ask which area or which limb is the main function is concentration. Okay. So it is important in this question, you can find some knowledge is correct, but is not related to the question. Like, for example, impermeability to water in thick ascending globule is correct, but it is not cause concentration. So permeability of the solid in the thick ascending limb is a correct answer. So D is a correct answer. Of course, loop of Henle and the effect, or nephron and the effect of diuretic. Of course, Lasix, who is the main acting in the loop of Henle, aldosterone acting distal tubule because it's counteract the aldosterone. 52 years old man is found with multiple myeloma. This common question also. What skull X-ray appearance is characteristic? Of course, skull appearance is important, but it is one of the important topic is hair on end appearance. Is anyone know what is hair on the appearance is characteristic for which type of disease?
Thalassemia.
Thalassemia or hemolytic anemia, so it is very important. Okay, yes. But we know that all multiple myeloma is like any tumor, because you know that all the tumor in the body is osteolytic except cancer prostate. So whatever the name of the tumor, just look into osteolytic secondaries, multiple osteolytic lesion. So is the correct answer. Forget the name of the tumor. Suppose this is like found have a breast secondaries in the bone, so osteolytic. Found some tumor in the bone, so it is osteolytic. So all the secondaries in the bone is osteolytic, whatever the name. Okay. I think the first one, diffuse thickness of the calvarium diseases occur in Paget disease. Paget disease is a precancerous condition, can be developed to osteogenic sarcoma. Next question is a 56 years old man undergo resection of terminal ileum. It's very important topic simply because terminal ileum have two function. It is the site of the vitamin B12 absorption. It is the site for enterohepatic circulation. And it is important to know vitamin B12 absorption need also intrinsic factor, and intrinsic factor is come from the stomach. So they need healthy stomach and they need terminal ileum. So because nowadays a lot of patients have bariatric surgery, they remove big part of the stomach, bypass, and all this. So this patient most probably have a problem in vitamin B12 absorption. Also, we know that iron is need HCl, so also they maybe have combined iron and vitamin B12. Come to our question. So resection of terminal ileum, secondary to ischemic bowel, but the common cause of resection of terminal ileum is Crohn's disease. Which one of the following effect is most likely seen in patient post-operative? Of course, in the post-operative period, the important is decrease reabsorption of vitamin B12. Okay. Next question, previously healthy 45 years old woman undergoes emergency splenectomy following traumatic rupture spleen. A left subclavian CVB line is inserted, give her fluid. Okay, currently she's become distressed and acutely dyspnea, blood pressure low, decreased breath sound. On the left, her temperature is hypo. What is the most likely cause? So he just forgets the splenectomy. He need this patient have one of the complication of the subclavian insertion. Of course, what you expected happen to this patient after insertion? Of course, after we do CVB, central line insertion, we send the patient for chest X-ray. If the patient distress, so what it could be?
Tension
Anyone?
pneumothorax.
Yes, of course. If you see here, decreased breath sound in the left. If you're more accurate, you can find the trachea shifted to the other side, so to the to the right side. Maybe hypotension is okay. So it is the tension pneumothorax. It is one of the common complication of the insertion of central line. Nowadays, it is less because nowadays insertion of central line is guided by ultrasound, superficial ultrasound. Next question is a physiology question. During proliferative phase of wound healing, the predominant cell are fibroblast. The cell is a mesenchymal origin, produce a matrix, collagen needed to strengthen the scar, cross-linkage of collagen required hydroxyproline, hydroxylysine residual, requires specific vitamin if available in sufficient quantity. Deficiency of which vitamin result of collagen unstable. So which vitamin responsible for transformation of hydroxyproline to proline? Anyone?
Vitamin C.
Vitamin C or L-ascorbic acid. Sometimes in exams they write vitamin C. Sometimes they write ascorbic acid. All are the same. Next question. A 19 years old man fall down flight on a stair on presentation to the emergency department. Glasgow scales 14/15, so it is good. No local neurological signs. An hour later, he vomit. Glasgow scale deteriorated, become 10. Fixed, dilated, left pupil. It is important to know if the patient have whatever the lesion, like extradural or paralysis in the other site, which pupil is dilated, the same site or other site? Anyone can answer?
Same side.
Same side. So it is important to know this patient dilated vexed pupil left side. So forget all the right. So it is the left. This patient is young and have head trauma, so most probably it is left side extradural hematoma. If the patient is very old, can be subdural, especially subdural, but usually subdural occur after many days. But if suppose it is occur early, so it is left subdural, acute subdural. Again, what is the cause of the extradural hematoma or bleeding or hemorrhage? Which artery?
Middle
Anyone?
meningeal artery.
And the middle meningeal artery arises from which artery? Is a branch from? Middle meningeal artery is one of two terminal branch of the external carotid artery, which is maxillary artery. So external carotid gives superficial temporal here and the maxillary. Maxillary give middle meningeal artery. So middle meningeal artery is arise from the maxillary artery and pass the skull through which foramina? Anyone?
Foramen spinosum.
Spinosum. Okay, middle meningeal artery is very important topic, very important question, either in anatomy or applied or trauma, because you have many questions in trauma. This usually is a common question. Next question. 70 years old woman, weighted 55 kilo, undergoes open cholecystectomy, post-operative pain relief by admission of intravenous morphine. Morphine 1 milligram, 5-minute lookout, 24-hour postoperative G agitated, confused, temperature 37, pulse 90, blood pressure 110/80, urine output 35, which is decreased, arterial blood gas as follow. Of course, it is important to know have the normal, just to compare. So these have acidosis, BO2 is within normal, CO2 is high, bicarbonate little high, mesoxis minus 6. So again, this patient is post-operative and in hospital. She take morphine. So it look like one of the side effect of morphine. What is the side effect of morphine?
Respiratory depression.
Respiratory depression can cause ileus, and the antidote of morphine is what? Antidote of morphine started by N. Morphine is M. Antidote is started by N. What is the antidote?
Naloxone.
Naloxone. Okay. So this patient have respiratory acidosis. So how to explain this? What is the cause of this respiratory acidosis?
Opiate-induced hypoventilation.
Yeah, opiate or morphine-induced hypoventilation can complicated by respiratory acidosis. Next question. 70 years old woman from a nursing home is brought to emergency department with abdominal pain and vomiting. On examination, she is hydrated and her abdomen distended. They are 3 by 4 centimeter painless swelling in the right groin. So what's your diagnosis first? There is no cuff impulse at operation femoral hernia is found. So now it is anatomy question. What is the following is lateral of the hernial sac? It is very common question. Sometimes I ask what is the medial border of femoral canal. So medial border is what?
Lacuna ligament.
Yes, and in this time he asked about lateral border. So lateral border is
Femoral vein.
femoral vein. So it is important again and again. The question in exam is fixed. We don't change the question. What we change, we just change this. Which of the following is the lateral to the hernial sac? So the answer become femoral vein. Which of the following is medial to the hernial sac? So lacunar ligament is not mentioned here. We can add it. So it is important. One of the main cause of failure in this exam, the student has the impression that they know the question. Actually, it's the same question, but the different in what they ask about. So it's very important to notice that. Don't rush in the answer. I think the next question is the same. 64 years old woman is receiving emergency department with acute right groin swelling below the lateral to the pubic tubercle. Which of the following form medial, here the medial boundaries or medial border of the ring that which is the hernia is protruded? So of course you know that it is femoral hernia. So and the medial border is the inguina is lacunar ligament. Sorry, lacunar ligament. Okay. Again, 27 old has pancolitis. Pancolitis means ulcerative colitis affects the whole colon for the last 5 years. Which of these complication is least likely to develop? Of course, ulcerative colitis can cause toxic megacolon, can cause ankylosing spondylitis or arthritis, can cause sclerosing cholangitis, can affect the eye, but not cause polyarthritis, because polyarthritis is a collagen disease. It's something like temporal arthritis or polyarthritis nodosa, something in the artery. But this is question is tricky because sometimes I see it polyarthritis like polyarthritis. So I say it is correct, but it is arthritis, not arthritis. So it is important to know that. Next question is about 20. What is next question? 147. Okay. Is a 48 years old woman insulin dependent diabetes mellitus has hernioplasty, no, hemoarthroplasty of hip 6 months ago, so 6 months, and has been long-term non-steroid analgesic, so maybe have osteoporosis. Urine output for urinary caster is 20 ml in the last 3 hours. 20 ml is very little because at least you have half to 1 ml per kilogram body weight. Suppose this patient is 50 kilos, so at least in each hour have about 50. So in 3 hours, maybe have 150. Her pulse rate is 120, blood pressure is little low, 100/60, capillary refill 3 seconds, blood urea electrolyte as follow. So sodium is little low, potassium for creatinine high, and it is important because it's more specific, urea is high. So what happened to this patient? 20 mils. So you have a little, and this patient is insulin dependent, has operation 6 hours ago. So just came from the operation 6 hours ago. So what happened to this patient?
Reduced renal perfusion.
Reduce renal perfusion. Yes, because it is pre-renal cause, so it is reduce renal perfusion. Yes, okay. Uh, I see in some version they have, this is a correct answer, okay? It is not acute tubular necrosis, because acute tubular necrosis usually occur if the patient or acute kidney injury, it is the same word. It is occur if the patient have severe bleeding and have a normal kidney, so have acute kidney injury. Usually the potassium is very high. So this is not acute kidney injury. It is pre-renal cause. You know that acute kidney injury or acute renal failure, we have pre-renal cause. So this is the reduced renal perfusion as pre-renal cause. Of course, again, if you have the same question in exam, and I write this potassium is 7, what is your answer? And the patient have acidosis, what is the answer?
ATN, acute tubular necrosis.
Acute tubular necrosis or acute kidney injury? Okay, correct. This is a common scenario in exam, and again, we don't copy and paste the question. From each question, we have many versions. Each version, we have little difference. Sometimes make the potassium high, make it low, something like this. Okay, which single respiratory test parameter forced expiratory volume in 1 second over forced vital capacity is best protected morbidity and mortality after surgery? This is complicated question. I write the reference for the answer. So usually the correct answer in these scenarios is forced expiratory volume more than, not more than, is less than 1 liter. So the number B. Of course, vital capacity is including tidal volume, inspiratory and expiratory reserve volume. Forced expiratory volume is the volume after severe or full inspiration and full expiration or forced expiration. Okay, so the answer is forced expiratory volume. 1 mean 1 second. It is less than 1 liter. That is the reference we are interested. Next question. 58 years old man admitted for inguinal hernial surgery is found to have enlarged heart shadow in chest X-ray. So which one of the statement is true in the right ventricle? This is also question in the anatomy. So right ventricle has a muscular wall that is normally thicker than the left. Of course, the left is thicker. So thick wall in the left is 3 times the right one. So it is wrong. Form the apex of the heart, not the apex of the heart is left. Form the right border of the heart, no. Directly related to diaphragm, yes. Give rise to aorta, of course, no. So the answer is directly related to diaphragm. 67 years old man admitted to hospital for investigation for irregular heartbeat. Conductive system of the heart, including one of the following anatomical structure. Conductive system, which is SCA node, EV node, bundle of Purkinje, and all these. So in this list, what is the conductive system?
Atrioventricular node, AV node.
Yeah, AV node. Okay, all right, correct. Next question is about hypothermia. Is very common ECG. One of the common ECG we discuss in the session of ECG. I hope be today or tomorrow or next time. ECG for hypothermia is very important. So 28 years old man is found to be seen in emergency service. He's alert but confused. His core temperature is below 33. ECG change that may be occur, including which of the following? He just need to ask if the patient have hypothermia, what the ECG change occur in hypothermia. Okay. We discuss it later in detail, but what we found in the hypothermia is prolonged PR interval. Sometimes you have artifact because of shivering and all this. So prolonged PR interval. Next question is a 75 years old obese woman presented with outpatient clinic with 3 months history of painless ulcer in the sole of left foot. On examination, deep ulcer, 1.5 cm over the first metatarsal head. Her foot is warm, pedal pulse are palpable, hemoglobin 13, normal urea electrolyte level. What's most likely cause of this ulcer? So it is just ask about ulcer. So the site of the ulcer is in the sole. So we can see the ulcers here, like venous ulcer, for example. Venous ulcers or varicose ulcer occur in gutter area near the middle malleolus. But here it is in the sole of the patient, sole of the left foot. So which ulcer can occur in the sole? Must be under pressure. So what it could be? Anyone?
Diabetic ulcer.
Yeah,
Diabetic
diabetic
neuropathy.
neuropathy or diabetic ulcer, because diabetic includes ischemia and peripheral neuritis, so it is common to have pressure sole and deep penetrated. Next question. A 24 years old man assaulted and sustained deep 2 cm long laceration in the lateral aspect of the lower leg. Physical examination shows the laceration is anterior to the lateral malleolus. Which of the following structure is risk being divided? So he just need to know the lateral compartment of the leg, especially lower part, is which nerve is related. Anyone knows the answer?
Superficial fibular nerve. Peroneal nerve.
Superficial peroneal nerve. And this is superficial peroneal nerve. After that become, what is the name? Become sural. Okay.
Okay.
So this is it will be sural after that. So the answer here is superficial peroneal. Of course, this is both in lateral part. It is important to know saphenous, which is branch of femoral, is in the medial border. Next question, 48 years old woman presented to emergency with persistent diarrhea. On examination, the hyperexia had irregular pulse for 140 beat per minute. What most likely is the cause of the abnormal cardiac rhythm? So forget the cause of diarrhea. Maybe have Crohn's, have something, but they have irregular pulse. So in this diarrhea, which electrolyte is disturbed?
Hypokalemia.
Hypokalemia, and it is give a picture mimic to ischemic heart. Of course, later we'll discuss ECG picture of hyperkalemia, hypercalcemia, and pulmonary embolism, and hypothermia is important topic in exam. We discuss it later. Next question, 45 years old woman is investigated after 2 episodes of renal colic. A plain abdominal X-ray reveals small obesity in both kidney. No abnormality is found on the physical examination. Biochemical investigation as a follow. So again, this question is repeated, but little difference. Corrected calcium 2.8, so it is some little high. Phosphate is considered okay. Alkaline phosphatase is very high, so they have some destruction. Creatinine is normal. Paras hormone is very high. So what's your diagnosis?
Primary hypoparathyroidism.
Okay, if you are just change this question and make the creatinine 200, what's your diagnosis?
Then it will be a secondary
Yes, okay.
hypoparathyroidism.
So hyperparathyroidism. So if the patient have normal kidney function, normal glomerular filtration rate, so it is primary hyperparathyroidism. If the kidney is abnormal, so it is secondary hyperparathyroidism. If I mention this patient after 10 years of renal dialysis, they have renal transplantation, so the kidney function is improved, but still the parathyroid hormone and the calcium is high. This is what we call the tertiary hyperparathyroidism. So again, if the patient have normal kidney, so it is primary hyperpar. Can be hyperplasia, can be adenoma. If the patient have diseased kidney, renal failure, so it is secondary to kidney disease, we call this secondary hyperparathyroidism. If the patient have transplantation done after a long period of the renal dialysis, so the kidney function is improved, but still the hyperplasia or hyperplasia of parathyroid is secrete a lot of paras hormone and have a lot of calcium. So in this condition, we call it tertiary hyperparathyroidism. Okay. Yeah, next question. 35 years old man developed septicemia or septic shock following surgery of perforated acute appendicitis. Is hypotensive, arterial blood gases refilled, pH low, acidosis, BO2 low, BCO2 little high, bicarbonate low. So what this patient have? 156. Okay, what this patient have?
Mixed
Of course,
metabolic
it is
and respiratory
acidosis.
acidosis.
Say again?
It's mixed metabolic and respiratory acidosis.
Yeah, so it is mixed. So it is acidosis, metabolic, and respiratory. So it is both. All right. Next question is easy. 75 years old man, chronic smoker, assist for surgery. He had short of breath on the minimal exertion. Chest auscultation revealed widespread wheeze. Chest X-ray show hyperinflated lung like emphysema, and arterial blood gases is likely referred. Which of the following change? So we need to choose which one of these. So we have A, B, C, D, E. So BCO2, what this patient have? It is chronic smoker. So most probably they have respiratory acidosis. So in respiratory acidosis, of course, pH not mentioned here is low. What about the BCO2 and bicarbonate?
Both are high.
Both are high. Yes, both are high. So why bicarbonate is high? It is correct,
To
but why? To
compensate the
compensate, because this is
acidosis.
chronic case, so it is to compensate. But if not compensated, it can be BCO2 high, bicarbonate is low or normal. Okay. An 18-year-old woman presented with recurrent tonsillitis, spontaneous skin bruises. On examination, there is no lymphadenopathy or splenomegaly. So we just need to exclude lymphoma, leukemia. So this patient, not lymphoma, not leukemia, because no lymphadenopathy, no splenomegaly, but have repeated tonsillitis and the skin bruises. So you have some of blood disease. What it could be, or some immunocompromised condition. So not leukemia. So what it could be? Not Hodgkin, of course. So what it could be?
Aplastic anemia.
Aplastic anemia. If they mention it is can take chloramphenicol or some medication, some antibiotic can cause a granulocytosis, but this patient not mention that. So this patient have aplastic anemia. Correct. Next question, have some debate. I just show you the difference. It's a 62 years old woman presented with a firm irregular mass upper outer quadrant of right breast, so it is kind of malignancy. There is show malignant on mammogram, fine needle aspirated cytology. She is treated by wide local excision, axillary clearance. What's the following histological finding indicate better prognosis? I change this question because the better prognosis, it means that BR is positive and HER is negative. Okay? Because in the other version, of course, absence of HER amplification mean ER positive, human epidermal receptor negative, amplification, absence of amplification negative, so it is correct. The other is not related because it's not indicate the prognosis. In the other version, maybe you can find in the YouTube, they write present of estrogen receptor. Present of estrogen receptor is correct. So I make it absence. So again, the good prognosis mean positive ER, estrogen receptor, positive progesterone receptor, and the negative HER receptor. Okay. 58-year-old man is due to heavy surgery for diphtheria contraction. Diphtheria contraction is something in the hand, fibrosis in the hand. To release a ring finger of tight hand. Which of the following is regarding the anatomy of the ring finger is correct? Of course, ring finger, you can find most of the nerve is share in the ring finger. So if I mention it is radial, medial, ulnar is correct. But here, because they have continuous innervation for medial, so it is correct. If say median is correct, but he mentioned his no, so it is wrong. No ulnar, because ring fingers, you can find most of the nerve share in it. Of course, flexor digitorum profunda inserted not in the middle, in the distal pharynx. Okay. Next question. And again, nervation, dermatoma is very important. A 75-year-old man with deep venous thrombosis, computerized tomography confirmed presence of thrombosis of the common iliac extended into IVC, inferior vena cava. So this is asked about foramina or opening in the diaphragm. So at which vertebrae common iliac vein join to form IVC. So he just needs a bifurcation or the continuation of the common iliac to become IVC at which lumbar vertebrae? Anyone? Anyone can
L5.
ask? L5. What
L5.
about the aorta?
Uh, sorry. L T.
Aorta L.
Oh, L4. L4.
Aorta L4. Okay, so aorta L4, IVC is L5. This level is very important. 35 years old, motorcycle, is involved in RTA and fracture his temporal bone. Completely the transection of facial nerve just distal to geniculate ganglia. What function of this nerve remain? Of course, this is important to know the distribution of facial nerve. So it is distal to geniculate ganglia. So it means that they still have only one function because the distal, like facial, smell, taste, sensation, salivary gland, all these are gone. So the only branch is saved is that deep petrosal nerve because it is superficial, so still lacrimation is preserved. It is just to explain, he just need to explain the anatomy of facial nerve. So still lacrimation, but other function, it is look like lower motor neuron lesion. So the all muscle of the face, posterior belly of the gastric can affected, stapedius muscle can affected, stylohyoid muscle is affected, sensation because chorda tympani carried through it, so the taste also can be affected. Of course, the smile because the muscle of the face. Next question is a 30 years old motorcycle is brought to emergency department after RTA accident. He is compound fracture is right femur. On arrival, he's tachypneic, confused, cold, and clammy skin. Okay, which of the following physiological change most likely to be seen? So these patients, they ask about which physiological change. Of course, this patient have metabolic acidosis because in a trauma, they have metabolic acidosis. So he just need which of the picture here is related to this metabolic acidosis.
Boy, decrease serum bicarb.
Decrease serum bicarb level. Yes, correct. B, decrease serum bicarbonate level. Okay. 50 years old man is waiting list for hip replacement. Attend pre-operative clinic. She has BMI 41, very obese. Risk of perioperative hypoxia. Reduction of which of the following parameter is most likely to risky in this patient? Of course, the respiratory function test is including tidal volume, inspiratory reserve, expiratory reserve. All these, what we called it vital capacity. If we add residual volume, we called it total lung capacity or total lung volume. So what is the important or what we do usually is the vital capacity. So the curve including the vital capacity, so the answer is vital capacity. A 4 years boy presented to emergency with 2-day history of headache, vomiting, drowsiness, CT revealed dilatation of both lateral and third ventricle. Fourth ventricle is normal size. So here they have some abnormality between connection between lateral and third. It is suspected to have obstruction to his CSF. Which the following is the obstruction site. So he just asks you what is the connection between the lateral and third ventricle. So the connection is which duct, what we called it.
Aqueduct of Sylvius.
Yes, aqueduct of Sylvius. Okay, so cerebral aqueduct of Sylvius. By the way, the other like Lushka and Magendie, it's just phenomena for drainage of CSF. So it is not the cause of this dilated ventricle. Next question. Next question also have a lot of debate and is come many time. 74 old thin man 2 day post-operative after urgent major operation abdominal surgery is noted to be confused. He has been on furosemide Lasix for mild heart failure. Plasma sodium is 122, so plasma is low. Inspection of the fluid chart shows it has been written 500 mil 5% glucose intravenous every 4 hours. So if you calculate half a liter every 4 hours, so how many liters this patient take? Anyone can count it? So it is in each 4 hours, so it's 6 times. So he take about 3 liter, maybe more, no, 5 liter intravenous every 4 hours. So it is 6 times. So it is about 3 liters, maybe more. So what is the cause of this patient confusion? Post-operative confusion is very important topic. So what is the cause of confusion?
Excessive IV fluid administration.
Yeah, so one is the older people usually if the patient is thin, like not the weight is not big. If you take more than 3 liter, of course, this patient take a lot of fluid or blood during surgery. So diluted hyponatremia or dilution hyponatremia is one of the common cause of confusion post-operative. Especially this common after TURB, transurethral resection of prostate. Just as the debate in this question, because in some answers they say use of loop diuretic. So use of loop diuretic, of course, decrease the potassium, but not affect the sodium level. During arch aortography, vertebral artery seen rise directly from which of the following? So what is the origin of vertebral artery? It is anatomy question. So it is arise from
Subclavian artery.
which part?
Uh,
First part
First
of
part.
subclavian. So important of see a question like this, just remind your anatomy knowledge, and it is important to know it is arise from which part. Okay. 60 years old non-smoker presented with 3 months history of loss of weight, malaise, breathing. On examination, left supraclavicular lymph node enlarged. Of course, the left supraclavicular node or Furchow or Furchow lymph nodes is characteristic of malignancy. Chest radiograph revealed multiple bilateral obesity. What is biopsy of left supraclavicular lymph node most probably show? Of course, he don't speak about specific tumor, just malignancy. If you come from the end, red Stringberg, it is for Hodgkin lymphoma. So Hodgkin lymphoma is multiple lymph node, not single lymph node. Langerhans cell or granuloma, it is occur, or granuloma or giant cell occur in tuberculosis. Usually tuberculosis is apical chest X-ray cyst or swelling in the apical of the chest X-ray. So this is a cancer. So it is a cancer. So it show multiple abnormal mitotic cell or multiple abnormal mitotic figures. Okay. Next question. 12 years old child admitted to emergency have inhaled peanut. What's the peanut most likely to lodge? So anyone? Easy question.
Right lower lobe bronchus.
Oh, yes, so it is right lower bronchus. So by gravity and the right side, why right side? Because right side is in the continuity of the trachea, so it is very common to be seen in the right side. Okay. Next question, 170. This is question speak about 69 years old man, chronic smoker, history of rheumatic heart disease. Now rheumatic heart disease is very rare. So we just either mention this patient have already rheumatic heart disease, or we say this patient is overseas or traveler or homeless or Indian or whatever. So it is gives the impression that they have this condition. Okay. Complaint of dyspnea, heart rate 110, blood pressure 140 over 9 millimeter mercury, cardiac auscultation, pan systolic murmur, radiated to the axil. Pan systolic, radiated to axil. And chest auscultation, fine cleftish over the middle and the lower zone bilaterally. Chest X-ray, feature of pulmonary edema, normal myocardial contour. Which of the following? So this patient have valve lesion. So which one of the following increase hemostasis response is main response to clinical picture? So this patient most probably have pan-systolic murmur radiated to the axilla. So the question is not about, he don't ask about the murmur. He ask about what the response for the clinical picture. So anyone got the idea what this patient have?
Mitral regurg, so sympathetic activity.
It matters, yes, but not sympathetic activity. It is increased systemic vascular resistance. Okay, so the answer, no, it is pulmonary vascular resistance. They increase the pulmonary vascular resistance. So the answer is increased pulmonary vascular resistance. Okay, so the answer is pulmonary vascular resistance. So what's your diagnosis again? Pulmonary or mitral regurg? Yes, okay. All right, next question. This question is not found in other version, by the way. So we make some modification. Next question is a 39 years old multiparous woman, chronic smoker, presented with 2x2 tender lump in right breast, is a brown discharge from the nipple. Mammogram is unhelpful. Ultrasound show dilated lactic duct. So again, this is young. So what is your answer?
Periductal mastitis.
Suppose this patient is 59. So what is the answer? Is not written here. What is the answer? 50 something, chronic smoker, have the same picture. So what we called it? Ductictizia. So in old non-lactated, we called it ductictizia. In young, we called it subperiductal mastitis or subiular abscess. Okay. In the past, we called the both together plasma cell mastitis. They found it is wrong term. They found it is due to chronic smoker occur in the female, and they found it is due to anaerobic organism. So this is why in this condition, whatever in young or old, we give her metronidazole for anaerobic organism. It is, of course, you need the patient to stop smoking. 172, 56 years old man presented with headache, vomiting, deterioration over the last 2 weeks. In examination, they have papilledema, CT, space occupying lesion in the right parietal lobe. He developed sudden homonymous hemanopia. So which part of visual system is affected? So we have homonymous hemianopia. So homonymous hemianopia, it is occur in two conditions. In optic radiation or in the area of the occipital lobe. So optic radiation is the correct answer. If we change it to bitemporal hemanopia, what is the answer? Bitemporal hemanopia. What is the answer? Optic asthma, and the most probably due to pituitary adenoma. Yes. Arterial depolarization shown by which in ECG? So arterial depolarization by ECG, it is which wave?
E wave.
B wave. So easy question is important to know that. Of course, in exams, they don't write like this. He make a scenario, and after that, he ask about this. 65 years old man is no ischemic heart if presented with paralysis of his right lower limb. What is the arterial tributaries most likely to be involved? You know that in the brain, the body is presented upside down. So the head is down, the leg is up. Okay, so first, this is paralysis. Which side? Ischemic or it is presented paralysis, the right limb. So if it is the right, so this is happened, they have something in the left side of the brain. So left side of the brain. Now, if the patient presented upside down, so the leg is up. So if here, so what it take, which artery taken by the upper part? We have anterior, we have
Anterior
middle, we have
cerebral.
posterior cerebral. Which one?
Anterior cerebral.
Anterior
Left
cerebral.
anterior
So the
cerebral.
answer is anterior cerebral. This is right side, so it is left. So left anterior cerebral. Okay. 91 years old man become hypotensive 2 days after total hip replacement. He's found to be AF, pulse 140. After treatment by digoxin, his AF show and has a pulse 90. Which form of venous wave is absent? So if the patient have atrial fibrillation, so which venous wave, you know, venous wave is this is like ACV and XY down. So which one is resemble AF or become increase in AF?
A wave.
What we call A wave. Okay. Jugular venous pressure wave is very important. We'll review with you also later. Uh, 56-old man, chronic emphysematous in HDU, 10 days after anterior resection of colon. He developed acute shortening of breath and hypotension. Which of the following landmark would be most appropriate to use to obtain femoral artery sample? So he just need the anatomy of the femoral artery, which between anterior superior iliac spine and anyone?
Point midway between ASIS and pubic symphysis.
Yeah, so it is between anterior superior iliac spine and the pubic symphysis, which is, we called it midpoint of inguinal, not midpoint, mid-inguinal point. So it is mid-inguinal point. Okay. Midpoint is for deep ring. All right. 45 old woman, insulin dependent, attend emergency department with abdominal pain, confusion. She has been treated for 3 days with antibiotic for chest infection, creatinine very high, blood sugar very, very high, most likely electrolyte abnormality. Okay, this is question have a lot of debate. Anyone give me the answer?
Hyperkalemia.
Yes, it is hypokalemia. The most of the other versions they write hypomagnesemia, but it is not a correct answer. It is the potassium is low because this patient have diabetic ketoacidosis. In diabetic ketoacidosis, so can have high potassium. So it is hyperkalemia, not hypo. It is hyperkalemia. So it is B. Okay. So this patient of diabetic ketoacidosis. I don't know why the other make hypomagnesemia is the correct answer, but I consult many of the doctors and physician and found the correct answer is high potassium or hyperkalemia. Okay, this is the end of the Fawzia sheet, by the way. So as you mentioned, this is the end of Fawzia sheet, so it is the answer of the all question come in this version. Okay.